Virginia Henderson is known as the First Lady of Nursing. She is well known for her concept of nursing, which states that the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or to peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge, and to do this in such a way as to help him gain independence as rapidly as possible. Let's take a look at her biography. Virginia Henderson was born in 1897, the fifth of 8 children of Lucy Minor Abbott and Daniel B. Henderson in Kansas City, Missouri. She moved to Virginia at the age of 4 and began her education at Bellevue, a high school operated by her grandfather, Richardson Abbott. In 1921, Virginia Henderson successfully completed her nursing diploma at U.S. Army School of Nursing in Washington, D.C. In 1931 or 1932, she earned her bachelor's degree, and in 1934, she acquired her master's degree. Her nursing career started right after her graduation in 1921. She worked for Visiting Nurse Association of Washington, D.C. In 1924 to 1929, she served as a clinical instructor and educational director at the Norfolk Protestant Hospital in Virginia. In 1930, she became a nurse supervisor and clinical instructor in the outpatient department of Strong Memorial Hospital, Rochester, New York. From 1934 to 1948, for 14 years, Virginia Henderson worked as an instructor and associate professor at Teachers College, Columbia University in New York. From 1953, she has been a research associate at Yale University School. In 1971, she transitioned to emeritus status and continued to serve until 1996. She toured the globe during her career to share and encourage not only nurses, but also other healthcare professionals. She constantly emphasized the responsibilities of a nurse to the patient rather than to the doctor. Henderson died at a hospice in Branford, Connecticut on March 19, 1996. At that time, her age was 98. Henderson earned many honors and awards in her life. In 1985, she received the Christian Riemann Prize, which was the most distinguished award in nursing. She was acknowledged by the Royal College of Nursing in the United Kingdom as an honorary fellow. She was appointed to the American Nurses Association Hall of Fame and acquired 13 honorary degrees from different universities. In 1985, she was given the Historical Nurse Leadership Award. An online nursing research tool was called Virginia Henderson International Nursing Library in honor of her name. In 2000, she was one of the 51 nurses who were acknowledged as pioneer nurses in Virginia. Virginia Henderson was in service for 60 years with remarkable contributions to nursing. She wrote 3 books that are widely used. These are The Textbook of the Principles and Practice of Nursing in 1955, The Basic Principles of Nursing Care in 1960, and The Nature of Nursing in 1966. Her greatest contribution to nursing research is a 4-volume literature called Nursing Studies Index. Virginia Henderson also made a significant contribution to nursing theory. She developed the nursing need theory, which explains the significance of patient autonomy and encourages patients to do as much as possible on their own in order not to prolong their hospitalization. She stated that the nurse's role may be one of the following: substitutive, in which the nurse acts for the patient; supplementary, wherein the nurse helps the patient; or complementary, wherein the nurse works with the patient. She identified the 14 basic needs in which, according to her, are the basis of nursing care. These are: breathe normally, eat and drink adequately, eliminate body wastes, move and maintain desirable postures, sleep and rest, select suitable clothes, dress and undress, maintain body temperature within a normal range by adjusting clothing and modifying the environment, keep the body clean and well-groomed, and protect the integuments, avoid dangers in the environment and avoid injuring others, communicate with others in expressing emotions, needs, fears, or opinions. Worship according to one's faith. Work in such a way that there is a sense of accomplishment. Play or participate in various forms of recreation. And lastly, learn, discover, or satisfy the curiosity that leads to normal development in health and use the available health facilities. There are four major concepts that are addressed in the nursing need theory. These are individual, health, environment, and nursing. An individual has basic needs and may need support to achieve health and freedom or painless death. The body and mind are inseparable. As a team, the patient and his family are considered. She considers health in terms of the capacity of a patient to conduct the 14 components of nursing care without assistance. She said that it is the quality of health rather than life itself, the margins of mental, physical vitality that enables a person to function most efficiently in order to achieve his greatest potential fulfillment in life. She used the Webster Dictionary, which describes the environment as the amount of all the external factors and influences that affect an organism's life and growth. Nurses have an integral role to achieve optimum health of the patient, making the patient capable or independent by collaborating with the physician's therapeutic plan. Nurses deliver care to the patients who do not have enough power, will, and knowledge, such as unconsciousness, the leg of the amputee, the eyes of the newly blind, and so on. According to Hamer and Henderson, the nurse should get inside the skin so that he or she will be able to identify the needs of the patient. There are assumptions of Virginia Henderson's need theory, such as 1. Nurses care for the patients until they recover and once again can care for themselves, although not explained accurately. Number 2, patients want to return to health. Number 3, nurses are prepared to deliver day and night care to the patients and help them recover from their illnesses. And lastly, Henderson also believes that the mind and body are associated with each other. They cannot be separated from each other. Virginia Henderson's theory is comparable to Abraham Maslow's hierarchy of needs. Both theories focus on personal, physical, social, emotional, and spiritual needs. However, Henderson's theory does not specify if the needs should be achieved in sequence. The components of the needs theory can be applied in Maslow's hierarchy of needs. The first 9 elements are biological. The 10th and 14th elements relates to psychological features of communicating and understanding. 11th component is spiritual and moral. Accordingly, 12th and 13th elements are sociologically focused in occupation and recreation. Now, we will apply the nursing need theory in a case scenario. Tony, 70 years old, was admitted in the medical ward due to ischemic stroke. 2 hours prior to admission, Tony was in the shower when he experienced chest pain, headache, blurred vision, and weakness in his arms and legs. He tried to call his wife for help, but his words were jumbled and he could not speak more loudly. His wife, Mary, was in the kitchen when she heard a loud bang. Mary hurriedly went upstairs and saw Tony on the bathroom floor. She called 911 and Tony was taken to the hospital. Upon history taking, Mary revealed they lost their dog a month ago who was very close to Tony. The couple used to go out for walks in the morning and afternoon with their dog, but completely stopped their routine after the dog's passing. His wife tries to encourage him to go out with her, but he did not have the motivation to do anything. He stays at home and watches TV all day. Tony has maintenance medications for hypertension and cholesterol. He is overweight and always adds salt to his food. He is also fond of snacking while watching TV. His physical assessment shows weakness of the right side of the face, slurred speech, hemiparesis, hemiplegia, ataxia, and dysarthria. Using the nursing theory process, the nurse can assess, analyze, diagnose, implement, and evaluate nursing management. Assessment is a professional accountability and an essential part of nursing practice. Using Virginia Henderson's theory, The nurse determines the problem and develops a nursing care plan for Tony. Based on Henderson's 14 components, the nurse identifies the following assessment findings. Tony is in oxygen therapy at 2 liters per minute. He is currently on NPO with IV fluids. With a Foley bag catheter in place, he has right-sided body weakness. Neurological assessment reveals 7 out of 15, which indicates severe brain injury. Tony is irritable and wanted to get up. He is wearing a hospital gown. His blood pressure is 155/90 with a temperature of 37 degrees Celsius and no signs of fever. Tony's wife reported that Tony showers regularly. His skin is intact but at risk for pressure injuries due to decreased mobility. Tony has decreased awareness of pain and temperature. Tony does not display harm to the environment or others, but he is at risk for falls. Tony is depressed with the passing of his dog but does not talk about it. Tony and his wife are non-practicing Catholics. He is a retired teacher and he lost interest in his routine when his dog passed away. His wife said that he used to spend his day doing yard work and going out for walks with her and their dog. He used to love cooking as well. Tony is having difficulty coping with his loss and his illness. Based on assessment findings, we developed the following nursing diagnosis. Activity intolerance related to impaired oxygenation, imbalanced nutrition more than body requirements, impaired swallowing related to dysphagia, altered elimination pattern related to urinary catheter placement, decreased physical mobility related to hemiparesis, loss of balance and coordinations, spasticity, and brain damage, risk for impaired skin integrity related to limited mobility, pain related to hemiplegia and disuse, self-care deficit related to loss of muscle control, disturbed sensory perception related to changed sensory function, impaired verbal communication related to slurred speech, ineffective individual coping related to situational crisis, anxiety related to disease and fear of death, and knowledge deficit related to further complication. Our client goals are the following. Tony will show improvement of level of consciousness, cognition, motor, and sensory function, and to improve physical mobility without signs of exhaustion. Tony will display stable vital signs with a blood pressure lower than 140/90 and reduced pain. To stabilize his bladder and resist the urgency of urination, to maintain skin integrity, to promote adequate nutrition and hydration. Tony will safely demonstrate self-care activities as much as he can, and to identify strategies in coping with stress and anxiety. The nurse must act according to the care plan and document the care provided each time. Informed consent must be acquired before the nurse performs the procedure. Interventions include the following. Identify short-term and long-term goals with Tony. Vital signs and GCS recordings as per physician's orders. Facilitate personal care twice daily and as required to keep skin clean. Promote confidence and involvement in caring for him as much as possible. Refer to a speech therapist for swallowing assessment to commence oral intake. Provide full range of motion exercises 4 to 5 times a day to maintain joint mobility, regain motor control, prevent contractures in the paralyzed extremity, and prevent further deterioration of neuromuscular system and enhance circulation. If tightness occurs in any area, perform ROM exercises more frequently. Exercise is helpful in preventing venous stasis, which may predispose the patient to thrombosis and pulmonary embolus. Prevent lifting Tony by the flaccid shoulder, pulling him on the affected arm or shoulder. Use proper patient movement and positioning, such as resting a flaccid arm on the table or using pillows when Tony is seated. For fall prevention measures, keep the bed in the lowest locked position, provide non-skid socks, and educate Tony how to use a call bell and ensure that it is placed within his reach. Establish routine and give Tony time to complete each task. Provide encouragement and give positive feedback. Encourage Tony to express his needs and respond to Tony's reactions and needs in a proper way. Treat the patient as an adult. Inform and engage his wife, Mary, in communication, as she is the only person who knows him better. Offer intense emotional assistance and awareness to alleviate nervousness. Avoid completing Tony's incomplete sentences. Maintain his interest when telling him. Speak slowly and give one instruction at a time. Allow the patient to process. Talk to Tony when providing care to provide interaction. Evaluation. Tony's vital signs are within normal range. He has no complaints of pain. Improved mobility is noted. He participates in a cognitive improvement program. He demonstrates improved communication. His skin is without breakdown. He verbalized feelings of loss. And he shows improvement in bladder training. He can hold the urgency of urination. Discharge instructions. Discharge instructions. Tony and his wife were instructed to call local emergency number or have someone else call if he experienced one of the following signs of stroke: numbness or drooping on one side of the face, weakness in an arm or leg, confusion or difficulty speaking, dizziness, severe headache or vision loss, seizure, and chest pain or shortness of breath. Tony and his wife were instructed to contact his healthcare provider if medicine is not helping or if he is having side effects. Keep a list of the medicines, vitamins, and herbs he is taking. Include the amounts and when and why he is taking them. Bring the list or the pill bottles to follow-up visits, and always carry his medicine list in case of emergency. Mr. Tony may need to come in overtime for brain function or blood tests. His provider may refer him to specialists or to other kinds of care. An example is palliative or comfort care. His provider can also give information about his respite care to anyone who helps care for Mr. Tony. Rehab is a program run by specialists who will help him recover abilities he may have lost. Specialists include physical, occupational, and speech therapists. Physical therapists help him gain strength and keep his balance. Occupational therapists will teach him new ways to do daily activities such as getting dressed. Mr. Tony's therapy may include movements for everyday activities. An example is being able to raise himself from a chair. A speech therapist helps him improve his ability to talk and swallow. Pressure stockings help keep blood from pooling in his leg veins. Remove anything he might trip over. Tape electrical cords down. Keep paths clear throughout his home. Make sure his home is well lit. Put non-slip materials on surfaces that might be slippery. An example is his bathtub or shower floor. A cane or walker may help him keep his balance as he walks. The case scenario of Tony shows the use of the nursing needs theory in a clinical setting. This theory is a foundation of providing holistic care to patients, guiding nurses in identifying the client's needs. Nurses act to support patients in activities of daily living, particularly those who are weak and powerless in performing their tasks. Henderson's definition of nursing is directly applicable to the professional nursing at present. Her theory and its components assess not only physiological data, but also psychological, sociocultural, spiritual, economic, and lifestyle factors as well. Application of nursing needs theory in nursing gives declaration to initiate immediate delivery of life needs. The promotion of assessment, planning, implementation, and evaluation of the 14 elements of basic needs are fundamental and must always be measured. Thank you all, and I hope you enjoyed our presentation.